Brought to you through the regional support of First 5 Fresno County, First 5 Tulare County, and First 5 Madera County. Because it's all about the kids.
Hello, I'm Juanita Stevenson. Welcome to 0 to 5 in 30 minutes. It can be tough to leave your precious little one in the hands of another while you go off to work. So you want to make sure they are getting the best care possible, whether it's a babysitter, a home daycare, or a daycare center. There is a program in the Valley which aims to serve as a link, connecting families and child care service providers with resources to meet the needs of children. This is the Small Wonders Daycare in Kingsburg. A couple of dozen infants and toddlers spend their days here learning and exploring. Daycare owner Michelle Hicks explains it's important that they are in a safe and healthy environment.
To ensure the safety of the kids and make sure that things are up and out of their reach and the outlets are covered and we're doing things properly and keeping them protected and keeping them safe for their parents and for us.
Rhoda Blankenship is a public health nurse and the coordinator for the Child Care Health Linkages program for the Fresno County Department of Public Health. Among the many services offered through the Linkages program are health and safety consultations for child care providers.
And the philosophy was that there's a lot of child care providers in our community, whether they're center-based, family child care, or if they're just grandma and grandpa watching their children, that they need health and safety resources. They need like that school nurse.
Rhoda is one of 3 public health nurses in the program who are certified consultants. They can provide ongoing health and safety consultations and trainings on topics including the control of communicable diseases, injury prevention, appropriate play equipment, child nutrition, and child health and development.
Part of what we do is training them on what is best practice. Best practice sometimes is above what licensing requires. So our goal is to educate child care providers on what's the best thing to do for children, not just hit that minimal mark. We want to go above that.
They also maintain a phone line to address questions from area child care providers in any language on topics from licensing to health issues.
We receive phone calls every day from child care providers where they say, you know, this child doesn't have this immunization. Should I not let them come because they haven't received all their shots? And so because we're with the public health department, we're able to give them that medical piece over the phone and guide and direct them.
Phone help is also available to parents regardless of income.
And for parents, we can work with them as long as their child is in child care. Either it's family child care or center-based. As long as they're 0 to 5 and they're in child care, we can assist them.
Public health nurses can also provide case management services for children with special needs.
So when we have children come in that are not reaching their milestones or are showing a few signs of maybe some developmental delays or other problems, we contact the Department of Health.
And we go out and we assist families and link them into services because sometimes that can be a nightmare. It's hard to know where to go, who to turn to, so we help them through that.
They can also train providers to care for children with special needs, from handling equipment to special feedings.
We want the provider to feel comfortable. A lot of providers, they want to do it, they just don't feel like they have the knowledge or the ability to do it, so we help them through that.
There is no limit on the number of requests for visits or phone calls from child care providers that the program will handle. The ultimate goal is to help providers meet the health and safety needs of young children.
And so by having a resource for providers to ask the questions, to have us come out and look at their site and give us, have us give them ideas of the best way of doing things, it provides quality of care.
It's a peace of mind for the parents and for us to know that we are on top of everything, kids are safe. So going through and making sure that we are being very thorough in everything, it's a good peace of mind.
Services under the Child Care Health Linkages program are free, paid for by First 5 Fresno County and the Fresno County Department of Community Health. For tips on what the experts look for when assessing a child care facility, go to our website for an exclusive web video guide.
Brought to you through the regional support of First 5 Fresno County, First 5 Tulare County, and First 5 Madera County. Because it's all about the kids.